Hello and welcome, everyone. My name's Hannah Laux. I work with government relations here on the NSTA team. We're very excited to have everyone this afternoon. So thank you for joining our flash webinar. This will be a panel discussion, so it might look a little different than other webinars you've attended in the past. In considering that it's a panel discussion, we're going to keep all of our attendees on mute for now until a question and answer portion at the end. We will then unmute everyone, so feel free to ask questions at that point for our two panelists. In the meantime, though, if you do have questions, there is a question box in your tab. Feel free to send those our way, and we can read those aloud for you. Without further ado, joining me here today is Erin Horetski. She's the Diabetes Prevention Program Coordinator for the American Association for Diabetes Educators, and Fred Bennett, who's the owner and operator of Fishing Creek Transportation. So Fred and Erin have graciously volunteered their time to talk about the importance of diabetes awareness and ensuring driver health and fitness for duty. So for NSTA members, you have access to grant-funded pre-diabetes education for your employees through a limited program with the AADE. So Fred and Erin are here to tell you a little bit about that. So first and foremost, thank you, Fred and Erin, for being with us. Erin, let's kick this off, and can you explain to me a little bit about the AADE and what it is you guys do?
Yeah, absolutely. And thank you so much, Hannah, for having both Fred and I on today. I work for the American Association of Diabetes Educators, which is a member-based organization that's dedicated to improving diabetes, prediabetes, and cardiometabolic care. We have a large membership base, about 14,000 members that are made up of nurses, registered dietitians, pharmacists, and physicians. And we provide our members with a variety of educational tools and support, including webinars and live courses. And in addition, are one of two accrediting bodies for diabetes self-management programs. So with that, we actually, a few years back, surveyed our membership base just to see the kind of work that they were doing, and found that a lot of our members were already providing preventative care and services to some of their patients. So in 2012, AADE submitted a proposal to get a grant from the Centers of Disease Control and Prevention to help scale and sustain the National Diabetes Prevention Program across the nation. So that was from 2012 to 2016, we were awarded this grant, and AADE worked with 55 organizations across 17 states to put up these diabetes prevention programs. With the end of that cooperative agreement, we actually were awarded another 5-year grant in 2017, the 1705, and this was to really focus on scaling the National Diabetes Prevention Program to underserved communities with little or no access to CDC-recognized programs, and engaging with priority populations, so really working with Medicare beneficiaries, men, African Americans, Hispanic and Latino communities.
So you've mentioned the National Diabetes Prevention Program a few times. Can you elaborate on what exactly that is?
Yeah, absolutely. The National Diabetes Prevention Program, which is also referred to as the National DPP, was created in 2010 to address the increasing burden of prediabetes and type 2 diabetes in the United States. So this is a national effort that created partnerships between public and private organizations to offer this evidence-based, cost-effective intervention to help individuals that were at risk of developing type 2 diabetes to prevent it. At the heart of this program is the lifestyle change program. It's called the Prevent-T2. And this really focuses on teaching participants how to make lasting lifestyle changes. So the curriculum isn't built to, encourage everyone to run a marathon or only eat salad. It really just teaches you how to, get exercise in your life, 150 minutes of physical activity a week, to eat healthy, how to cope with stress, how to deal with like really hard times in life, and just improve those coping skills. And one of the large goals of the National DPP is to offer everyone, including, school bus drivers and their friends and their family, an opportunity to join in and participate in a program like this that's not only affordable, but it's also high quality and will really teach you how to improve your health overall. And the way that the National DPP is set up is it can be delivered in one of two ways, one of them being in person and one of them being online. So across the nation, there's about 1,700 DPP sites. You can actually go and look on the CDC's website, type in your zip code, and see if there's an in-person class near you. And it could be at like a community center, a hospital, a YMCA. But for those that are on the move more and they might not have access to be able to meet with a class once a week, there's also a virtual option. And this right now, we actually at AADE have partnered with Omada Health to give this program to individuals holding their CDL. So, yeah.
Thank you. So can you explain to the group what exactly is prediabetes and why it's something we should be taking seriously? Is there anyone in particular that may be at risk for either prediabetes or type 2 diabetes?
Yeah, no, absolutely. So prediabetes is something that's, the awareness is still continuing to be made to providers and individuals, but it's a serious health condition where your blood sugar is higher than normal, but not yet high enough to be diagnosed with type 2 diabetes. So you're kind of in this weird in-between phase where you don't need to take insulin or these medications, but if you don't do something about it, you're at risk of developing type 2 diabetes, which can, damage your body and cause really serious health problems like heart disease, vision loss, and kidney disease. It's estimated that 84 million Americans in the United States have prediabetes. That's 1 out of 3. And if nothing is done, a lot of those individuals within 5 years will go on to develop type 2 diabetes. There's a variety of risk factors involved, including if you have an overweight BMI, so body mass index, if your age is an indicator, so if you're 45 years or older, family history and genetics, so if your parents have type 2 diabetes, if you have siblings, if you're not physically active, you're not seeing yourself, get out walking 3 times a week or more. And then other things that, you can't really help, your race, ethnicity. A lot of times individuals that are Hispanic or Latino, American Indian, Pacific Islanders, African American have a higher risk. And then also certain occupations. So, if you're sitting around all day, people at desk jobs, they might be more at risk, but especially those that hold their CDL, they particularly have a high risk of developing pre-diabetes that would later go on to type 2 diabetes. And for a lot of those individuals, they just have a greater chance to form chronic diseases and health conditions such as heart disease, hypertension, obesity, compared to the average U.S. working adult.
Wow. So, Erin, you mentioned CDL drivers are at a higher risk. Fred, do you find that to be the case amongst your drivers that you employ?
Well, as we were discussing earlier with the 1 in 3 Americans are pre-diabetic, and I would think that parallel would apply to our drivers as well. But based on the features of the symptoms of the people or characteristics of the individuals, I think that the rate could actually be higher for school bus drivers and truck drivers from our experience. And I think the sitting around, being sedentary, although it's an active job in terms of being able to in terms of the driving itself, but in essence, the body itself is still sedentary in the chair for long periods of time. And then whether they are engaging in exercise, eating properly, I think the parallel applies with how Americans generally eat and take care of themselves with school bus drivers as well. So I think that it's likely to me that the percentage would be greater than 1 in 3 that school bus drivers would be pre-diabetic.
Great. Well, thank you. So, Erin, you spoke a little bit earlier about the National DPP program, which is available through AADE, and also who's at risk, including school bus drivers. And Fred, you just elaborated on that a little bit more. So, Erin, can you describe how you can sign up for the program through AADE and how long it takes to complete the program and what costs, if any, are associated with signing up and going through?
Yeah, no, absolutely. That's a wonderful question, and thank you for bringing that up. So right now, through our cooperative agreement with the CDC, AADE has partnered with Omada Health to bring this to CDL holders. So specific to this grant, anyone that's interested in applying for the Omada program would visit their website at omadahealth.com/HTAA. And once there, individuals will be directed to take a 1-minute risk screener to see if they're at high risk for developing type 2 diabetes. In this risk screener, it's going to ask things like, age, weight, height, have you ever been told that you have prediabetes? It's going to ask like blood pressure levels. And really quickly as you go through, it's going to identify if you're at high risk or if you're not. If you are high risk for developing type 2 diabetes, then you can apply on the spot instantly for the Omada program. It's a really, really easy process. It takes about 5 minutes to complete, and it's just going to ask a little bit more detail about your health history and just some questions about, address, demographics, etc. Once you submit the application, an Omada Health coach will give you a call within a week to get you enrolled into the program. A week before the program start date, you're going to be mailed a welcome kit directly to your house or wherever you identify that you want it sent. And in this kit is a wireless smart scale. There's exercise bands, there's tape measures, there's some pamphlets. And it's all going to be connected to your account already. The way that you activate it is really just by stepping on the scale, and that will take your initial weight. The great thing about this program, too, is you don't have to have access to Wi-Fi. So you can just step on, and it's automatically going to get sent to their database. Once the program starts, you're also going to be matched into this small private group. And the way that they match you is by identifying peers that are in similar occupations, at similar stages of life, might have similar interests, so that you can really relate to them and, bounce ideas or, share the same kind of stresses and how you might cope with them and have similar weight loss goals. So you're not, having very drastic weight loss goals. The Omada program is actually broken into 2 phases. There's the first phase is the core program, and the second phase is the sustain program. The core program is 16 weeks long, and on average, participants spend about 2 hours a week on the course learnings. You'll be able to log into your portal, and each week you get a new topic and a new lesson that covers things like healthy food habits, how to increase activity levels, how to reinforce healthy habits, how to deal with stress, how to read a food label, etc. Once you've completed the initial 16 weeks, you will move on to the sustain program, and that's for the remainder of the year. So It's a year-long program, 16 weeks that are weekly, and then you kind of just check in as needed. And you're going to have access to all the original tools and resources. You'll be given shorter weekly lessons that you can log in and try. And you'll be connected to this larger community of OMADA alumni where you have the opportunity to reach out and support individuals. So as for the cost, Hannah, that's a great question as well, too. Right now, this program is at no cost to individuals holding a commercial driver's license. So it's free to any drivers that are interested in participating in the program.
Well, thanks, Erin. That seems pretty straightforward and easy to go through. Fred, would you agree that that's something that your drivers would find easy to complete and participate in? And could you maybe give us some detail on how, as a business owner, you could and should be encouraging this pursuit of driver wellness?
Well, with regards to the driver being willing to participate in the program, I believe education of their specific condition would be a motivating factor in conjunction with the number of drivers that they see. Not that we disclose the information, but they talk amongst themselves, among the drivers who are actually diabetic and who have to manage their diabetic waivers. And so I think with the recognizing from their doctor that they would be pre-diabetic, or maybe taking a test or doing a little bit of research on their own and finding that they don't want to travel the road that those who have been diagnosed with type 2 have to travel. And so with that, there may be a motivating factor. And once they feel susceptible to having diabetes, and then the encouragement of the dispatchers or their supervisors, if you will, or the company itself, that we are showing that it is for their own good health to participate in the OMADA program, I think would be beneficial to them. The latter part of your question is how it would benefit our company. And I think some of the examples that we've used in previous discussions is that if you could flash forward 10 years from now, and as you said, if they're pre-diabetic now, those conditions would manifest themselves within 5 years. So if you go 5 to 10 years down the road, and you have a shortfall of drivers of a number of those who are no longer driving as a result of being pre-diabetic, it would be very beneficial if you could go back in time to present day and then actually invest the time, energy, and resources to get drivers to participate in a program that they might be able to circumvent their eventual diagnosis had they done nothing at all. So I think in terms of a staffing issue, I think in terms of a PR issue as well, with regards to your own employees, that you would be in a position to show that you really do care about them, more so than just trying to cover runs. And I think that's where the true benefit is that it increases the relationship with your drivers in the short and long term.
Yeah, absolutely. So it sounds like Fred's in, right, Erin? So
yeah.
So Erin, can you Erin, can you describe how you would roll out the program at Fred's operation, or anyone else's operation for that matter?
Yeah, no, absolutely. Whether working with Fred or any other contractors out there, it would be a really simple, easy process where if you're interested to make this program available to your drivers, we would set up an initial conversation, kind of do a WebEx showing you the platform, what the program looks like, answering any questions that you all might have. And then if you decide to move forward with providing this to your drivers, we'd identify the best ways to get the information out about this program to your drivers. And that differs from business to business. So it could be sending text messages, it could be doing a webinar, it could be coming on site and enrolling drivers while they're there in person. And there's a variety of ways that we can actually tailor the information to your specific company. We can do, tailored train the trainers, tailored flyers, tailored social media ads, a lot of different things. But I think one of the most important things that we can offer is getting the aggregate level data specific to your drivers. So if you choose to move forward with the program, we would give you all like a special source code. So for Fred, it might be something like phishing for his transportation company, just so we can identify which of his drivers are enrolled in the program. And then on a monthly basis, we kind of get like a high level overview. Everything's de-identified, so there's no patient information being shared. It's very confidential, but we'd be able to tell him, you have 5 drivers enrolled. Together, they've lost a combined 210 pounds. On average, they're getting 300 minutes of physical activity each week. And so really the first step would be reaching out to our team at AADE, and you can do that by phone or email, and the email address would be dpp@aadenet.org, and we'd set up that initial phone conversation to get the ball rolling.
Thanks, Erin. So, Fred, I know you talked a little bit earlier about, the straightforward and ease of the program, and why, as a business owner, you'd want to encourage your drivers to participate. Do you think that your drivers would be hesitant to participate despite all of this? And, is there any way that you've found that you can combat that fear, that nervousness in signing up to go through the program?
Well, one of the things that we experience with our drivers through the course of time, a little bit off subject, is when we first introduced direct deposit 15 years ago, it was met with, it wasn't well received just on the surface discussion. And after we educated them as to what it would actually be, they were still hesitant. And but as they began to experience the benefit of it, they're on full board, and obviously now direct deposit is a way of life. And I believe with any new activity or requirement, and not so much that it would be a requirement, is that you are in a position to that you're in. I'm sorry, I got a little distracted there by something. We are in a position to educate the individuals as to the benefits, and then once a few of them start doing it and communicating to the others, I think the program then could take legs.
Yeah, that's great advice, and it's hard to think of a time when we didn't have things like direct deposit, but I'm sure it was a little apprehensive for some, just like health is apprehensive for many. So, Fred, while we're on the topic of it being beneficial, can you think of any additional benefits, to your company as a result of participating in AADE's program?
Well, one of the things that I think with regards to the benefits, in addition to the relationships and, keeping your staff healthy in the long run, is the relationship with the local school district. If they're aware that you're participating in a program to keep the drivers in good health, I think that shows that your character as a service provider to the school district is that of one of caring to ensure both you fulfill your obligations as a contractor, but also that the children are being driven by individuals who are keeping themselves in the best fitness of health that they possibly can.
Yeah, absolutely. So, Erin, do you have any other insight to what additional benefits there are in participating in the program? Just to piggyback on what Fred had to say.
Yeah, I think that Fred brought up a lot of great points, and I think something that really resonates with me that he addressed is this building this higher morale between your employees and just the people that you work with. A lot of times you spend more time with the folks that you work with than your family, because that's just the reality of it. And so it's just proven that these wellness programs help boost employee morale. They create stronger company culture. They bring employees together to really work towards achieving their fitness goals. And when Fred said, you know, it takes kind of one to take the leap, and then once they start to share their experience, it starts to go on. But once you get that higher morale, just everything kind of flows down from there, you know, healthier behaviors, so maybe less sick time being called in, there's less stress, so people are excited to come to work. And I think to Fred's point, a lot of times it's easier to not know if you're at risk or if you're at risk for developing any kind of illness. So a lot of people don't, and we call that kind of the fear of finding out. But once you take the chance and empower yourself to really learn how to develop these habits, I think a lot of great things come from that. And one of that being just this like higher feeling of community and wellness within your workplace. So.
Yeah, absolutely.
And if I may, if I may interject, is one of the concerns that we have is with regards of, as Erin mentioned, is the concern with their health, is the not wanting to know. And I also think that they have a little bit of a privacy issue. In here we are at work, that work is a public portion of their life. Their health is a private portion of their life, and merging those two together, I think, is very uncomfortable for many people. Despite the fact that their health and physicals and diabetic waivers and cardiac waivers and TB testing and all of these items are part of the job, I think that diving too much into their private portion of their life can provide some hesitation from the drivers as well.
Yeah, and Fred, I would definitely agree with that. And I think, you know, something that's great about this program is as a contractor, you can offer this, you know, say, hey, this is out there, this exists, and they can go on and, you know, take that screener, and you might never know, you know, you might choose not to see the data or how many people are actually enrolled into the program. But the difference between the in-person and this online is, you know, it's a lot different bringing this program on site and having everybody share their personal health history or just stresses that they're dealing with that they don't want to bring to the job place. So having that opportunity to enroll in this online community where people are similar to you, but also, you know, aren't going to be seeing you face to face for the next 5 days in a row, is a really great option for a lot of individuals, and I think can, you know, kind of ease some of that fear and hesitation to enroll. So.
Great, and thank you guys for giving us all that information. That was really, really awesome. So we're going to transition now into our Q&A portion. So I'm going to start opening up the phone lines. If you have a question, please feel free to ask at will. Just to give you some contact information as well, if you do have questions for Erin that you don't feel comfortable asking online, her contact information is here, or if you'd like to ask NSTA a question, our contact information is here as well. So.
Hi, this is Rich Kelly. I do have a question for Fred on two lines or two fronts. One, just in terms of risk management and your insurance interaction with your agents and things like that, do you think that this is a sort of program that would actually be the sort of thing that your insurance agent or underwriter might look kindly on in terms of just acting as a responsible employer and hopefully having that reflect on the quality of your company as an insurer, someone to insure?
Well, I believe that when we meet with insurance agents and we go over what our different safety programs are and so on and so forth, and they have an actuarial benefit if you have a safety program in place, it would be my impression that they would be receptive to the idea that you're taking steps from an angle that has not necessarily been all that discussed up to this point, that would show that the drivers would be safer while actually out there operating the vehicles, then thus ultimately reducing the possibility for a claim to them, which is, is their ultimate goal.
And from the perspective of drivers, I know that recruiting new drivers is a challenge, and retaining good experienced drivers is also a challenge. So do you see also this program and the fact that you're promoting it and making it available to your employees as something that would be a positive as you're trying to recruit new drivers to join the company and encourage those experienced drivers to stay?
I would think from the recruiting aspect, I think it would have to be the program would have to have been established for a little bit to demonstrate that it's up and going and that there are some sustained benefits and sustained positive response from the current drivers that we could then relay back to potential new drivers. With new recruiting, with the retention aspect of the school bus drivers, I think that in general conversation in driver meetings where there's a good give and take, and you can address their concerns, in the present, rather than just sending them a letter in the mail or a note in their paycheck or a text or whatnot. I think if you present it in a manner, in a form that they can immediately respond to you face to face with any questions or concerns, I think that would help alleviate them getting in. But then as others are starting to hear the concerns are being alleviated by the logical answers that you provide based on those questions, it would give them some comfort, and then they would recognize the true benefit of both AADE and also the employer, in this case being Fishing Creek Transportation.
Super, thanks.
Thank you. I have a question for Erin here. So, Erin, is there a cycle that you're following, or can anyone sign up at any time? If you're interested and you wanna kickstart this tomorrow.
Yeah. So the way that it works under the grant is our grant year runs from October 1st until September 29th. So we're in the middle of our second year, and we have allocated 300 spots for those holding a CDL to enroll. So if you are interested, we still have a lot of those slots open. You can go on today in the next 5 minutes to that website and apply and get enrolled into the program. And it is a 5-year grant, so each year we're going to have slots available and open. If you have a larger group of individuals, that's okay too. We want you to share it with everyone. And as the grant funds end after the 5 years, and this is something you still want to offer, that's a conversation that we would partner you with OMADA or any of the other virtual diabetes prevention program coordinators so that you can figure out the pricing and next steps on how to get this as a covered benefit indefinitely. So.
Great, and thank you. I want to open it up to the rest of the group. Does anyone else have any questions for Fred or Erin? All right. Well, hearing none, thanks again, Erin and Fred. I think this was great that you've volunteered your time to kind of inform us about the important part of this program and why it's so beneficial to our companies. We are having our next webinar. It'll be next week. So keep an eye out on your inbox. We'll send out a link to participate to that one through Constant Contact and also on Facebook. So that'll be hosted by Fogmaker. And they'll be talking about Fire Suppression 101. We are also gearing up for our 2019 bus-in. So if you're signed up to attend that, we'll see you very soon. Otherwise, thanks again for listening in, and we'll see you next week.